introduction in Arabic. Bismillah ar-Rahman ar-Rahim. Salatu wassalam ala Sayyidina Muhammad. Let me introduce to you the man himself, Dr. Clifford Mann, OBE, the previous president of the Royal College of Emergency Medicine. Am I right, Cliff?
That's right, yeah.
And the current top advisor for NHS England on emergency and urgent care.
Correct.
And part of the crisis, or the top man on the crisis management team in the UK. As we agreed, Cliff, this video is with the intention of educating and raising the awareness about the COVID-19 in places which are considered underdeveloped and, in other words, third world. So, first of all, thank you very much for giving me this opportunity.
No, very well.
And secondly, what's your thought about the whole COVID-19 situation?
Well, the thing about the COVID-19 is it is actually the first real pandemic to affect the world for almost 100 years since the Spanish flu of 1918. Unlike influenza, which comes around every few years, the difference with the COVID-19 is that it's much more contagious and it's much more deadly. So it's at least 10 times as deadly as the influenza virus. And the influenza virus kills hundreds of thousands of people every year. So it's a real challenge, and it's a very non-discriminatory virus. So it affects all ages, though it does affect older people to a greater extent. And it particularly seems to be a problem for people who have problems with blood pressure control.
Good. So that would lead us to the second question. There is a misconception that the COVID-19 doesn't affect people of certain age, which is the 20 to 40s. And secondly, as this is intended for my home country, Sudan, people are talking about the heat as being a factor that prevents the virus from spreading.
Yes.
Do you think that's right?
So the latter point first, no. The virus isn't inactivated until the temperature is in excess of 52 degrees centigrade. So even in Sudan, most of the time, the skin of people is not going to be 52 degrees centigrade, and it's on the skin of people that the contact of the virus is going to be made, and through people coughing and breathing, and then touching their faces, and then touching the surfaces of other things such as door handles and cups and tables, and other people touching them. In terms of it not affecting people 20 to 40, unfortunately in the UK we've had a number of deaths of people in that age group, including some healthcare workers and other young adults thought to be previously well. Around the globe, that's also the case in other European countries, particularly in Italy, and it was certainly the experience in China as well. So, although, as I say, it is more likely to have a higher mortality in older patients, the young can also be affected. The youngest person to die so far in the UK was 13 years of age. And many, many patients in this hospital have been admitted in their 40s, 50s and 60s. And so it is a disease that is relevant to all age groups.
Thank you very much for clarifying that point. Now, secondly, there are lots of talks around about the chloroquine, vitamin C, zinc. Is there any proof or any scientific evidence that this can help with the COVID-19?
There's no scientific evidence at all regarding vitamin C, and no plausible explanation why it would work. For the chloroquine, there are a number of trials actually going on at the moment. But the experience again from China and Italy, where they've had many, many more cases, is as yet there's no definite evidence that chloroquine helps. There have also been a number of deaths from people who have taken chloroquine without using the prescribed dose. And so chloroquine is not a drug that has an entirely safe profile, and it's not proven to be of any benefit to patients with COVID-19 disease.
Thank you very much, Cliff. Now, social distancing, a very, very big issue, and especially in Sudan with people taking it lightly. What's the role of social distancing in terms of preventing the spread of the virus?
Social distancing is actually the most powerful drug we have. If social distancing was a drug, people would be paying huge sums of money and they would be queuing up to get it, because it is by far the most effective way to manage the virus. With social distancing and keeping yourself more than 2 meters away from other people, mixing only with your own household, avoiding contact with people outside your household, working from home wherever possible, and minimizing interactions with other people for a period of some weeks, means that over the course of a fortnight, every one person who is infected will infect probably 10 or 15 other people. Whereas without social distancing, they will infect thousands of other people. So the difference is not a linear difference, it's an exponential difference in the number of people who are affected. And so it's vitally important that wherever possible, social distancing, remaining only in close contact with your own household, the people you normally live with, and distancing yourself from other members of your family, other friends, and wherever possible from work colleagues, is by far the best way to reduce the number of people who will catch the disease and the number of people who will die from this disease.
Thank you very much indeed. Now, I would like you to give an advice to the health care workers and specifically doctors with no or limited resources. What would you advise them to do?
So the important thing to remember is this virus is spread by droplets and by touching the surface of the patient or the surface of items that the patient has come into contact with, where the viral particles may be on the surface, and then touching your own face. So the most important thing is to ask patients who are coughing to wear some form of cloth over their face, a scarf or item of clothing, so that when they cough, they don't cough over everybody else. The second most important thing is don't touch your own face, and this is actually quite a hard thing to do. But every time we touch our face, we move potentially contact with viral particles onto our face and significantly increase the risk of infection. The third thing to remember is that the virus is easily inactivated by soap and water, warm water preferably, but the most important thing is the soap, because the viral particle has a lipid membrane and soap will destroy the lipid membrane. You need to wash your hands for about 20 seconds with soap and you will kill the virus. So the most important things are for patients to cover their mouth if they have a cough, and for healthcare workers to wash their hands very regularly and not touch their face.
Thank you very much indeed. Now, as you know, within these communities, there are lots of rumors, lots of people who come with theories which are not being proven, some of it which are not scientifically proven at all. That's one. Two, they always mention some sort of local treatment and they always say it's proven. What would you tell these people?
So exactly the same rumours and fake news, for want of a better word, went round China and Italy and every other country. It's completely normal for people to turn to miracle cures when faced with a virus they don't understand, because they have never seen it before. Unfortunately, there is absolutely no evidence that any of these things that have been tried work. The only effective way to stop the virus spreading is social distancing and meticulous attention to washing your hands and not touching your face. And the only proven treatment for somebody who has severe COVID-19 disease is oxygen therapy. No other medications, whether that's in the United States of America, China, Northern Italy, or the UK, have been demonstrated to save the lives of COVID-19 patients.
Thank you very much, Cliff. Now, thank you very much for providing me with all the evidence and the material which I'm going to happily send back to people in Sudan. Now, this is generally for friends who are working in the NHS. And let me express my utmost respect for all the colleagues who've been working very hard. And I have to ask you personally, how are you coping?
I'm coping fine, but thank you very much for asking. One of the things that we all need to do during the pandemic is make sure that we look out for each other as well as ourselves, and we give ourselves an opportunity to share our feelings, because unfortunately this is an indiscriminate virus we will see patients and sometimes friends and family taken from us by this virus. And so emotionally it's going to be very challenging for many colleagues, nurses, doctors, but also all the other people that work in the hospitals, the cleaners, the porters, the radiographers, the receptionists. All of these people are going to come into contact on a daily basis, I'm afraid, for a while yet, with the consequences of this virus, which will mean the death of loved ones, either theirs or people they know.
Okay, finally, how long do you think this can last, roughly?
Well, that I'm not necessarily sufficiently expert to know. But in the UK, we expect the peak of this disease to happen towards the end of this month. And remember, it started back in February. I think our first death was in the end of February. So it's taken about 2 months to get to the peak. If the social distancing measures are very effective and we keep them in place, then we think we may be able to relax some of the social distancing measures by the end of May or into June. So this is a disease where the first 4 or 5 months are crucial in terms of trying to flatten the curve and reduce the number of people who catch the disease. But the virus isn't going to be gone then, and the virus will be in our communities until such time as most people in the world have either caught the virus, and therefore there's a degree of herd immunity, or a vaccine is developed and made available to all people. So the reality of this is that we as doctors and nurses certainly will be living with COVID-19 for probably at least another 18 months.
Thank you very much indeed. Thank you very much for your time, Cliff. I know you have to go home.
Yes, fine.
Okay, we'll do the elbow shake.
Yeah.
It's been a pleasure. Thank you very much for your time.
Thank you so much, Emma.
No problem.
All the best.
Take care. Okay. That's really useful, yeah.
Thanks.
And I'll post it.
Yeah,
Okay.
Sure.
Ooh,
Let me do that.
thank you.
Well, there you go.
Thank you very much.
How was last night?
It was wonderful.